everyone. Welcome back. Hope you are doing great. So today we are going to discuss about the health and medicine, how it is viewed in the ancient Bharat. Okay, the concept of health in the ancient Bharat was holistic and integrative, emphasizing the harmony between mind, body, and sense and the soul, rather than the absence of the disease. So health was not defined merely as a absence of disease, but as a balanced state of physical vital, mental clarity and emotional stability and spiritual harmony. Human beings were considered as more microsomes of nature, and well-being is dependent on the living in the accordance with the natural laws. So in ancient times or in the ancient Bharat, usually, the health or medicine is viewed in terms of Ayurveda, the science of life. So, the ancient Indian medicine was primarily based on the Ayurveda, which literally means the science of life. Ayurveda conceptualized the human body as composed of five basic elements. That's a Panja Mahabhutas, Panjabhutas. Okay, we simply call as Panjabhutas or Panja Mahabhutas. That's a Prithvi, Jala, Agni, Vayu, and Akasha. That is the earth, water, fire, air, and the earth. Okay, so Prithvi, Jala, Agni, Vayu, and Akasha. Okay, these elements combines in varying proportion to the form three fundamental biological energies of dosha. Okay, so these energies will combine into various proportion and contribute to three biological energies known as Vata, Pitta, and Kapha. Vata is the movement and nervous functioning. Pitta is the metabolism and transformation, and Kapha is the structure and the stability. Health was maintained when these doshas remained in the equilibrium. So, healthy individual or a person without a disease is viewed as these three components, Vata, Pitta, and Kapha, are in a balanced state. And when a person is diseased, result that there is an imbalance in these three doshas, that is Vata, Pitta, and Kapha. Okay, which may be due to the improper diet, lifestyle, and emotional stress and environmental factors, which leads to the imbalance in the three gunas. Sorry, three doshas. The diagnosis in the ancient Bharat was highly systematic and individualized. Physician relied on the detailed observation, that is darshana. Questioning is prashana, and examination is pariksha. Assessment included the examination of pulse, urine, stool, appetite, sleep pattern, body temperature, voice, completion, and emotional state. So in the earlier, how a disorder is diagnosed is based on their pulse rate, urine, stool, appetite, and sleep pattern and body temperature, voice, and their emotional state. Okay, so the special importance was given to understand the pattern, so the patterns in their habitat, personality, mental state, and social environment. So there is an additional attention was given to the patient habitat and their personality and mental state and social environment. This reflects an early biopsychological approach to the medicine. So very earlier, only the diseases were viewed as a biological approach, that the root cause for a disease only through their biology. But in later on, a disease must be viewed in a way that its factors may be biological, social, and psychological. So, which leads to an approach called biopsychosocial model, and this marks as the beginning of biopsychosocial approaches. Okay. And the treatment methods were equally comprehensive and personalized. They include dietary regulation based on the body constitution, the use of herbal and mineral medicine, and physical therapies like massage, oil application, sweat therapies, and detoxification procedures known as panchakarmas. So, okay, and treatment in the earlier was based on their balancing in their daily routine, their dietary regulation, uh, consumption of herbal and mineral medicine, physical therapies, oil massages, and body strengthening exercises, which is known as panchakarmas. Okay. Then also along with this yoga, meditation, breathing practices were given to the patients for the treatment procedure. Prevention was considered superior to cure. The great emphasis was placed in the daily routines. So if a person is having a diseases or a patient is prone to a disease, the prevention was basically based on their daily routines, that is change their daily routine and seasonal routine and personal hygiene and moderation in the habitat and moral discipline. Okay, daily routine is a dinacharya, that the day to day things we are doing in the life, or okay, changing some habits in the dinacharya will leads to prevention of these diseases. So mental and the physical health were inseparable in the ancient medical thought. Emotional disturbance such as anger, fear, grief, and excessive desire were believed to weaken the body and predispose the individual to illness. So controlling of this fear, grief, anger, and excessive desire to something was need to be controlled by the person itself. Thus, cultivating a mental discipline and emotional balance and spiritual awareness was considered essential for the overall well-being. So, in this way, the health, the medicine, the treatment and prevention of illness, health and medicine was viewed in the ancient period. Usually in the form of Ayurveda, usually changes in their daily routine, habitat, their mm, their day-to-day activities will help them to prevent from a disease. Okay, so thank you.